I am Dr. Nanda Rajaneesh. I am a surgical oncologist in Apollo Spectra and Sakra World Hospital. In laparoscopic hernia surgery, what we do is, one, we close the gap, that hernia gap, manually through laparoscopy, that is putting some holes itself. So abdomen is not cut. So we are putting a mini holes here and there, and we are going to close the gap. And then we put a mesh to reinforce the abdominal wall. So to know what is the difference between laparoscopic and open hernia surgery, you need to know what we do in open hernia surgery. So in open hernia surgery, what we do is, we cut the abdomen, we repair the hernia, we remove the sac, we remove the adhesions, and then we put the mesh either in internal layer of the abdominal wall or the external layer of the abdominal wall. But to put the large mesh on the abdominal wall, we have to do a lot of dissections, and then we have to place the mesh. That means the dissection of the abdominal wall happens as much as the size of the mesh. So in laparoscopic surgery, the advantage is we don't do any dissection, except we're releasing the adhesion and removing the sac. Then we just put the mesh from inside. But these mesh are very expensive and they're very special to reinforce the abdomen so that they do not damage the intestinal bowel loops which touches them. They have to be very smooth, they're very specialized, and we also use certain clips to fix them with the tackers, which are now absorbable tackers that are available. So technology is advanced, and even the type of mesh and tackers that we're using also have been better and better every time we have been doing these surgeries. So I would definitely say that I do less dissection, and post-surgical complications like infection, seroma formation is also very less in laparoscopic surgery, especially pain. Pain post-surgically, if the laparoscopic surgery pain is 1, in open surgery pain is 10. So that much of difference is there in the pain also in the post-surgery. And hospital stay in the laparoscopic hernia surgery, maximum 24 hours admission is required, whereas in open surgery at least 2 to 3 days of admission may be needed, and there is a drain that is required to be placed on the mesh because there is a lot of fluid coming because we do an excessive dissection. So this is the reason definitely laparoscopic hernia repair is better than the open surgery.